In this podcast episode, we want to introduce you to our BCEN friend, Megan Wood. Come along as Michael Dexter and Holly Briggs talk with Megan about the journey from paramedic to transport nurse. She speaks to the challenges of ground transport nursing, particularly for high-risk OB care. This episode is called Take Care of You on the Go.
Hello, and welcome to the BCEN Friends podcast, where we hold interesting conversations about learning with a range of thought leaders, BCEN certification holders, and industry professionals. But most importantly, to create value and insight for you, our professional nurses across the emergency spectrum. We hope you find our discussions interesting, informative, sometimes funny, sometimes serious, and always valuable. I'm Holly Briggs, a professional development specialist at BCEN and one of your hosts for today. I'm joined by my co-host, Michael Dexter, Director of Professional Development at BCEN. Hi, Michael.
Hello, Holly.
It's great to have you with us. And in this episode of BCEN and Friends, we have Megan Wood. Megan has a career that has spanned from pre-hospital to flight and transport to critical care and OB. She has taken every experience and used it to help educate and transform practice to improve the care of patients wherever she goes. Michael, could you please introduce us to our BCEN friend, Megan?
Yeah, I'd be more than happy to. Megan Wood is currently a critical care ground transport nurse with AHN LifeFlight and holds the CFRN and pre-hospital registered nurse certification. She also works as a nurse intensivist, critical care, and L&D nurse at a Pennsylvania area hospital. Megan began her career as a paramedic for over 10 years in a busy 911-based EMS system, and also as a flight paramedic. When she became a nurse, she continued to fly with Stat MedEvac in Pittsburgh and worked some shifts in a local hospital. After a few years, Megan decided to embrace change and jumped into an ICU role in her hometown of Washington, Pennsylvania. And once she had a few years in the ICU, she changed her role in the labor and delivery unit. It was here that Megan discovered a great passion for women's health and has used that knowledge to teach other healthcare providers on the topics of fetal, maternal, and neonatal care, as well as transport considerations for this special population. Megan, welcome to the BCEN and Friends podcast. It's a pleasure to have you with us.
Hi, yeah, it's great to be here. Thanks for asking me.
Yeah, we're happy to talk with you. And you and I had talked previously about the EMS world, which you had started in, and the discussion was that a lot of times in the EMS world, the statement is made if anybody is in labor to just get them to the hospital as quickly as possible, and we don't deliver babies in the back of an ambulance is often the thought process. And so working in EMS and working in transport, you don't often hear of somebody that has a passion for maternal, fetal, neonatal care. So I wanted to get into that, but before we do, if you don't mind just telling us a little bit more about your career in healthcare and specifically how you got into ground transport. I know you did some flight as a paramedic and then later as a nurse, but tell us a little bit more about the ground transport role.
Yeah, so I actually kind of fell into it. I was sort of just looking around for other jobs, and the AHN ground unit had just begun back in 2019. They had just opened a ground unit, and just out of curiosity, I decided to go for an interview. Really liked what they had to say, loved where it was going. It focuses a lot on critical care. It's a lot of ICU to ICU transfer. And then I also realized after starting there that my OB background was going to be very helpful and really try to help expand the care of women, especially in that critical care environment, transport, because transporting those high-end people is a difficult thing to do. So it's something, like you said, in the back of an ambulance, nobody wants to deliver a baby. Well, nobody wants to deliver a baby, especially when it's a high-risk mom. So that kind of took a specialty to me. But after going to the ground unit, I think my background really brought me to it because I have a lot of pre-hospital care background as a 911 provider and then flying, and kind of didn't want to fly anymore. So it's a nice transition between the two of those. So that's sort of how I got into the specialty of ground.
And in that specialty, I know there are some teams that are very, very specific, for example, like a neonatal transport team. But in your role with your organization, what would be some of the types of patients that you care for, the types of disease processes that you see, and maybe even some of the age ranges of patients that you typically transport?
Our age range is all over the board. While we're not part of the neonatal team, there is a division of our hospital unit that does have a neonatal team. They use our ambulances, but they do provide their own care. That's probably the only population that we don't transport by ourselves. Everybody else from pediatrics across town to all the way up to 105-year-old, I think is the oldest patient we've transported. And all kinds of disease processes too. Over COVID time, we did a lot of ECMO transports. We added nitric to our units and transported patients on nitric for that, especially respiratory. We can transport patients in a prone position, which is kind of more difficult to do in the air than it is on the ground, but it can be done in the air. We do ethos machines. We have balloon pumps on all of our trucks. We do balloon pump transports pretty regularly. Impella machines, we use those as well. And then just basic critical care transports on a ventilator, high-end different medications, just all types. But probably our highest population is basically ICU to ICU type transports.
Just you talking about the different patients and the different diagnosis and the different treatment that they are receiving, I'm literally just being flooded with all of the different technology pieces and the supplies, and like, how are you fitting all of this in the space of the back of an ambulance? It seems overwhelming.
It does, if you're an ICU nurse, especially because you're used to everything being in a specific area. We kind of work in the people that work in this type of environment are a special type of people. We are a combination of ICU, ER, pre-hospital, all of those things all meshed into one. And we work on the fly. Like, we can do whatever you ask us to do. And in fact, sometimes we get asked to do things that are outside of our usual comfort zone. But pretty much everybody I work with will just make a phone call to a doctor and say, this is out of my comfort zone. How do I fix this? And then just transport the patient. It can be daunting at first, especially to our new people that start up there. But then once they get used to it, most people that work there just love it because it's such a unique environment. So
it sounds that way. And I guess my follow-up question to that is, have an extensive background as a paramedic and experience with that, and then also in transport, both flight and ground. What would you say are kind of the greatest differences in those two roles, and also the complementary aspects? Because I recognize that in transport, it's a complete and total team effort. And as you said, it's not only a team effort, but it's also a team effort in a very confined space. So what's the differences in those roles? But then also, how do those roles fit together so seamlessly?
So 911 EMS, like paramedic type role, is very act and then think kind of role. I've taught both paramedics and nurses, and this is probably the biggest difference between the two in the education world as well. So paramedics are taught that we have a problem, let's fix it now and get to where we got to go as fast as we can. Nurses are taught to think the long term of things, like, if I give this medication 5 years from now, is this patient going to have an issue? But paramedics aren't thinking that way because they got to save the life right away. So when you look at like transport of an ICU patient, or even flight where they do scene runs and things of that sort, you have this combination of things where, yes, you have to think outside the box of what is going to happen to this patient in the future, but also I got to fix the problem that's going on right now. I have to stop the bleeding, and then figure out why is the patient bleeding. So it's an interesting complementary aspect, and it's not for everyone. Not every 911 provider can be a flight nurse or a flight paramedic. Not every nurse can be a flight paramedic or a flight nurse. So it's kind of a role that you have to you have to have a specific kind of personality for, and you can kind of live on the fly. I don't really have a whole lot of OCD people that I work with like you have in the ICU. We don't label things because we don't have time to label things. We just know where they are. And it is a small environment back there. So you do have to be very comfortable with the people you're working with, which we all have how my crew works is we have a EMT that's couple of primary jobs for them. They assist us with everything because they don't just drive. Our EMTs that I work with in particular are amazing. And then I have a paramedic or a nurse partner that's in the back of that ambulance, and we're the ones that are doing everything. We have protocols, but the doctor's not there with us. So we kind of make our own decisions a lot of times, but it's unique. And I think it actually fits my personality pretty well because I'm very even kiltered. My bosses at the hospital often say that I am unshakable with everything. And I don't even realize that I'm not, but that's the personality that works really well in this environment. So.
Yeah, 100%. I've heard the same thing before. People just have asked me, do you ever change? Like you're the same in a code as you are in a conversation. A lot of,
Yeah.
You just kind of learn to be very consistent with your actions and consistent with your thought process. And over time it helps. And one of the things that we have a lot of hesitancy for, and I say we as emergency nurses, is around the whole issues of pregnancy, whether it's trauma, whether it's imminent delivery, these things. And I think part of the reason is people become so hands-on. You can, start an IV on a patient, you can administer medications, you can administer oxygen, but when that individual has not delivered yet, you just feel like you're almost helpless. All you can do is care for the mother, and oftentimes that's what's needed, is the mother needs care, and it helps the infant. But in terms of caring for the nurses and paramedics that are caring for this, and when I say caring for, I mean educating, providing emotional care, providing support for them in understanding, helping them bridge the gaps in their knowledge to be able to care for these. Tell us a little bit more about some of the things that keep coming up as constant educational points in the pre-hospital environment and even in an emergency department, of things that you have really been honing in on and trying to teach people about care of this high-risk population.
So there's probably a couple things to that order. What I've noticed when I noticed this when I worked in labor and delivery, when we needed to transport out a high-risk patient. So the labor and delivery department that I worked in we couldn't really handle anybody that delivered under 34 weeks because those babies were considered premature, and our nursery wasn't a high enough level to take care of those infants. So a lot of times if the mother wasn't in active labor, we would try to transfer her out to a better facility for her to deliver. So for instance, a preeclamptic mom who's running high blood pressures and very high risk, she needs to deliver sooner rather than later, or her life is at risk. So but that baby is also too premature to be living outside of basically a neonatal ICU. So we need to get her transferred before the baby's born, so the baby can be born in a safe environment. But a lot of times, we would call a local ambulance service, which, by the way, again, they're great. I love 911 providers. I'm good friends with all of them, so I don't want it to sound like I don't like them. But they kind of take the patient in like she's not in active labor, which no, she's not, but she's on a magnesium drip. And they don't necessarily know all the risks that are involved with the magnesium drip, other than their experience with magnesium, which is mainly with respiratory patients. And a mom is on a much higher dose than we give with respiratory patients. And you got to figure she's got two people there to take care of. And in utero, like a lot of times in transport, if I went to a 911 provider right now and said, could you give me a Doppler fetal heart rate? They wouldn't have any idea how to do it because it's just not something they're taught. But it's something they should be taught. In the critical care transport world, we are taught that, but I think it should be even further than that. And we should move on to fetal monitoring like they use in the labor and delivery rooms. A lot of ERs do have those. I don't know if your guys' ERs do, but I know our local ERs down in Pittsburgh will have a fetal monitor, even if there isn't a delivery room there. And either it's like wirelessly transmitted to another delivery department, or they have to read it on their own. And there's just very few people in the ER, like you said, that are familiar with reading those. So it's really important to know like what's bad, basically just like with an EKG reading, know what's the normal, what's bad, and what's really, really bad, so that you know what to do ahead of time and know when you're in trouble. And in my experience in the critical care transport world, that's basically what you need to do for every patient, is know what's okay, know what's really bad, and know what's really, really bad. So that's one of the things that I think we need to work on in the transport world. And then things that we forget about too is postpartum, what we do with mom. Bleeding and high risks are still there postpartum. And we tend to especially in the ER, you deliver a baby, everybody's excited, the baby comes out, it's breathing, it's great. But we forget that mom could still bleed to death, basically, if we don't do things the right way. So those are probably the two main things that I think we need to focus a little bit more on. But like you said, people get scared of it mainly because it's not there all the time. You start IVs every day, 10, 12 a shift or something like that in the ER. Even in the ICU, you probably still start a couple IVs every day, but you don't deliver a baby every day. So those are just some big things that we don't really look at as much. So
I think that's some great advice, Megan. And to your point, the best thing when it comes to scenarios, patient cases, when you're just unfamiliar, is trying to familiarize yourself with them. And you've taken a lot of your experiences and the things that you've grown comfortable with and translated that into education related to OB and transport, and applying them in the various areas that you've worked in. And I think that just speaks volumes to taking your experience and then not only adjusting your practice and making changes, but then trying to help other people kind of bridge those gaps in their own familiarity with OB patients. And I'll be honest with you, that is one type of patient that probably, no matter how many times I take care of them in the ER, they're always going to be one that, there's a little bit of a knot. There's a little bit of like, okay, all right, what do I remember? It's kind of like you're pulling from the back of your brain, like, what am I supposed to know here? What am I supposed to remember? It's just not that like ready set. And so I think having someone who has that expertise, who translates it into good education, things that I can get my hands on or wrap my brain around. It really is so valuable and so important. So thank you for being that person for your team, for the people that you work with. We very much appreciate that. And I know they very much appreciate that. If they had a chance to be on this podcast too, I'm sure they'd tell you, thank you for caring so much about women's health and OB. So your past experiences, you have just been consistently accumulating knowledge through certification. You've done degree programs, you've created educational content. I mean, really, it just makes you a great resource for a lot of topics in healthcare. Other than OB, because we have talked about that a little bit, what are some of your favorite subjects to kind of just teach on or expound on?
I actually really like the way that paramedics learn with the hands-on training. It's something going through both of those trainings myself, doing paramedic and nursing. I love hands-on training. So simulation training is probably one of my biggest, I just love doing simulation training because even though a lot of people are just not real comfortable with it, people walk in and they're like, oh, it's a mannequin. I still think they learn more than just talking about it in a subject, because anybody that works in healthcare is usually a very hands-on type of person. And even seeing it on a mannequin, that's probably one of the ways I really love to teach is through simulation training. But other subjects that I like cardiac a pretty decent amount, but over the past probably 4 or 5 years, especially with the pandemic and everything, I feel like septic care and that type of thing has really jumped into view for me, and really trying to understand the idea of fluid replacement and understanding that, CHF versus fluid replacement and what's more important at what time and what antibiotics are going to work for what bacteria. It's kind of become a little bit more interested in me. I do have another background in pharmacy. I spent 3 years in pharmacy school before deciding to do EMS, and I'm raised by 2 pharmacists, and I have a pharmacist brother. So basically at any family events, we sit around and talk about medicine. And so I like to keep on track with that so I don't sound stupid talking around them. So.
Well, that's awesome. It's always interesting to have a lot of friends and family you can sit around and kind of nerd out on some of these things with. Different groups when I get together with friends that are nurses versus the conversation I have with those that are not. So really neat discussion that we've had. And one of the conversations we like to have with everybody on the podcast is really kind of centered around what makes you you. And you certainly had just mentioned family that's in medical fields as well. But apart from that, is there any certain person in your career or in your life or a certain moment in time that you can look back at and say, this really changed the trajectory of what I was doing? This has really impacted me as an individual or impacted me as a professional. Any particular time or person?
There's been a lot of them, honestly. There's a flight nurse I used to work with when I flew at Stat that really influenced me to being who I am, because she was who I wanted to be basically when I started as a flight paramedic. and she kind of guided me. Her name's Holly. I'll have to tell her I did this podcast now so she can listen in. But she really influenced me into moving on in my career and becoming a nurse and kind of becoming who I was, I guess. But probably the biggest thing that happened to me is a little bit dark, and I don't know if you want to hear it or not, but when I was back a long time ago, 9/11 actually happened, and I worked at a pharmacy at the time, and I came home from work, and there was a older gentleman across the hallway who had hung himself, and my roommate and I found him, and my fiance at the time, and we basically, I felt helpless, didn't know what to do, couldn't help him. I mean, I think he was probably already dead, but we called 911, and then I watched everybody do everything that they had to do. And it kind of, a couple months later, I went to EMT school basically and kind of decided that that was the route I wanted to go rather than being a pharmacist. So that's probably the other big impact, but that one's a little dark. So if you don't want to put that in there, I understand.
No, I think it's important. I've heard similar things. I spoke with a nurse that was on a boat with some friends and as a teenager, and her friend ended up having carbon monoxide exposure and passing away. And it really encouraged her to learn more about the medical field in order to make an impact if something like that ever happened again. And I've heard these stories before, and I think there's a lot that healthcare workers can relate to in terms of having an event in life that really encourages them to want to know more about healthcare so that a similar event wouldn't happen in the future. And so I definitely see a lot of value in that very unfortunate situation. And you've certainly been able to impact a lot of people in a positive way in spite of what happened to that individual. So thank you for sharing that.
Yeah, it's an interesting story. My mother, in fact, was like upset with me that I didn't tell her about it when it happened to me, but she got over it. So
I think it's interesting sometimes for families, family members, people that care about us, our tribe, when they hear some of the things that are darker, but they impact us, right? I mean, not everything in healthcare is bright and shiny and fantastic, right? And anyone listening to this podcast is probably rolling their eyes. But we're a product of both the great things that we get to see and witness and be a part of, and then also the ones that aren't so great, that are a bit darker and that are equally as impacting. And I think sharing both, sometimes that is more difficult for the people that care about us and our families to hear that, but it also does shape who we are and who we become. And I think that it can motivate us to want to learn more about certain things that happen, right? So that way you take something that made you feel very helpless and made you feel like I don't know what to do, and you turn that into, I'm not going to be helpless if I ever come across the same situation again. I'm going to know more than I did then. And I think there have been moments in my career, and I'm sure Michael could say the same, where I just told myself, I'm like, I'm never going to be that helpless again. If I come across the same situation, I am going to know and be able to respond differently. So it can motivate you probably just as strongly, if not more, that feeling of being like, okay, I'm not going to do that again. So, but thank you for sharing that. I know it's a very personal thing, but again, I think a lot of people in healthcare can relate to exactly what you said and exactly kind of the feelings that you had. So thank you for sharing that. All right. I am going to completely change the trajectory of our podcast and do a few rapid fire questions. And they really have to do with your favorites. And Megan, it's just so we can get to know you a little bit better. So the first one that I'm going to ask you is, if there was a career outside of healthcare that you'd like to try, what would it be?
Oh, I would be a brewmaster, 100%. Go make some beer.
Okay, follow-up question. Do you already have the name of your brewery? I have such trouble with that word because I want to add extra R's in there, but there's only a couple. So do you have a name picked out already?
No, because every time I see a new beer, I think, gosh, that's a good name for a beer. And then I think that's a good name for a brewery. And then I'm like, oh, now I got to think of a new one. So not really, but I'm sure if I did something, it would be locally, like my area. We're big on Washington is big on a whiskey rebellion. Mm-hmm. Google it sometime. It's very interesting. It's an amazing festival. So I think it would probably have something to do with that.
Ooh, okay. I like that. it's got ties to your community. It's a good reflection of you. And that to me, like if you're going to come out in that space, you really do have to be kind of, niche, authentic, but also super marketable. So, okay, we will look for that in the future, Megan. All right. Some more favorites. And these can be all-time favorite, or they can just be something you're currently into. So favorite book.
Hunger Games.
Nice. Whole series, you like the whole thing? Or was it like one particular book?
I really liked the first book and the second book. The third one was a little bit too long, but it was still good. So
I understand. I feel like she was trying to fit like 2 books in the last book. She could have definitely like spaced it out a little bit, but maybe she was done with it. Maybe she was like, I'm ready to move on to something else. Maybe, probably not, but maybe. All right. Favorite movie, TV show, or possibly a binge-worthy series that you'd recommend to us?
Well, I'll give you 2. I said my favorite movie is Back to the Future, and I watch it all the time. And TV show, I actually have 2 of them. My all-time favorite is Xena Warrior Princess, and then would be I watch the Gilmore Girls a lot. So,
in a complete twist of irony, I literally said Xena Warrior Princess yesterday in a conversation when I was being asked about, women's topics, blah, blah, blah. And I'm like, man, we talk a lot about like princesses and queens. Like, where is Xena at? Where is the warrior princess at? And I was like, man, I think I just dated myself a little bit, but it's a great show. I'm so glad you brought that one back.
Yeah, it's a great show. I actually named my youngest daughter after Lucy Lawless. So,
so cool. She's got a great name. All right.
Yes.
Favorite musical artist?
I have 2 favorites. You probably won't recognize one of them because it's a local band. They're called the Clarks. They're local to Pittsburgh. But my all-time favorite is there's U2 or the Cranberries. I really like Irish music. So
classic. And I also like that you threw in your favorite local band because, some of those are so good and you get to see them in these like smaller venues. And honestly, when they're local, you get to kind of like hang out with them, hear their music evolve. So thank you for sharing all of that. And U2 Cranberries classic. I mean, you can't go wrong. So great recommendations. All right. Last question for you. What is your self-care go-to or a hobby outside of healthcare that really helps you reset?
Well, we've already discussed my beer obsession, but I love going to baseball and watching sports. I will catch a local sports game any time of the day. So
awesome. Well, you know what? You can go there, hang out, sip on something, cheer for your favorite team. And if it's local, you could probably cheer for one team one time, cheer for the team the next, just however it kind of goes. That sounds fun, man. I hope that it does just help you reset. Thank you for sharing all that, Megan. If our audience wants to follow you online, what social media platforms could they follow you on?
I have LinkedIn.
Awesome. So we will post up the LinkedIn information in our blog for this episode.
All right. Well, Megan, thank you so much for sharing all of your background about your professional career and also your passion for maternal, fetal, and really all sorts of education, even simulation and things. It's been really great talking with you and shining a spotlight on ground transport nursing and all the incredible things you're doing. So we really appreciate it. And also the story that you shared about why you became a nurse and why you got into really healthcare in general, I think is important for others to hear. So I appreciate you sharing that with us.
Yeah, thanks for having me.
Well, I want to take this time to thank Megan for joining us for this episode of BCEN Friends. Thank you, Megan, for sharing your expertise, your passion, your experiences with us. You've shown you don't waste any of the knowledge you've gained and you turn them into education and learning opportunities for others so then they can give patients the best care possible. It's truly amazing to hear about all that you've done and all you continue to do. And to all of our listeners, we hope you will stay tuned as we continue with BCEN Friends and bring you new, meaningful content and perspectives. If you have a suggestion for an episode, please email us at bcn@bcn.org. I'm Holly Briggs here with Michael Dexter, and on behalf of the entire BCEN team, we thank and celebrate you for all that you're doing as professional nurses across the emergency spectrum. Until next time, we are out.